Hello, my name is Pete Miller. I'm from Millbrook Benefits in East Longmeadow, Massachusetts, and we are an employee benefits consulting firm. A lot of our clients and other employers have asked us recently about creative ways to control cost with their benefits package. And so what I thought I would do is record a couple of videos to share some ideas with you that might get the juices flowing and give you some ideas about ways you might be able to control and reduce the cost of your benefits package. In this first video today, we're going to talk about the individual coverage ICHRA. And so a lot of you have probably heard about an ICHRA in the past. Just a quick refresher. ICHRA is an acronym that stands for a health reimbursement arrangement. And the way it works is an employer can set up an ICHRA and reimburse their employees for a portion of their out-of-pocket costs that happen when they use the medical plan. So it could be reimbursements for deductibles, co-payments, prescription drugs, or what have you. The individual coverage ICHRA is something that's pretty new. It started on January 1st, 2020. I'm recording this in January of 2021, so it's only been around for about a year. And basically, it's kind of a similar concept, but instead of reimbursing necessarily for out-of-pocket costs only, it also allows an employer to reimburse employees for their cost to buy individual health insurance. That could be individual health insurance or it could be Medicare. One of the nice things about this is individual rates, when health insurance rates in the individual market don't necessarily take into account the claims experience in a particular group. And so what can happen is if you have a client or an employer that's large enough so their claims matter and are taken into account with the pricing of the plan, using individual rates can oftentimes yield better pricing than the group rates that you're getting from your group insurance company. The individual coverage ICHRA was set up so that it'll still count as an offer for coverage under the Affordable Care Act, and it can also be set up to avoid ACA penalties. There's calculations that you can use to make sure the plan is still considered affordable as far as the ACA goes. So I find that the best way to introduce an idea is to tell a story, because the last thing all you folks want to do is listen to me prattle on about some of the specifics with individual coverage ICHRA. This slide will basically walk you through a client that we worked on last year. They've got about 60 people eligible, and this kind of gives you a sense for how the plan was set up. They did have an ICHRA in place already. Their annual premium was just under $500,000. Their ICHRA that they had was actually running really well. And so the reimbursements were very low at $2,400. So their total annual current costs when we were working on this was about $494,000, still under $500,000. The renewal premium, they were looking at $560,000. They thought that their ICHRA expenses would remain low in the upcoming plan year, so we were looking at the total estimated cost for the upcoming plan year somewhere around $562,000. Definitely an increase in cost, and I'm certain that if you're watching this video, you've seen increases in cost with your plans as well. So one of the interesting things about this particular client is they've got about 60 people. I'm in Massachusetts, and when you're a group health insurance plan in Massachusetts, and you have more than 50 people eligible for your plan, the claims are taken into account. This client had about 60 people eligible, and they'd had a number of fairly large claims over the years, and that's accumulated to the point where their rates were pretty high. And this year was going to be no exception. The rates were going up again. And sometimes that happens fairly often. So anyway, what we did is we looked at what an individual coverage ICHRA would look like. So instead of group insurance, what we're going to do is look at what would happen if we used individual insurance policies instead of group insurance policies for the folks to get their health plans. And what we tried to do was set up very similar plans. Interestingly enough, we were able to, the company that they have in place for the group insurance plan also offers individual insurance in Massachusetts, and we were able to get almost identical plans for the vast majority of employees. So we're looking at about $562,000 if we renewed with the current company. The individual coverage ICHRA was going to bring it down to about $355,000 for a savings of over $200,000 over the course of the year. So the numbers can be really compelling with an individual coverage ICHRA. It doesn't work out all the time, but it works out often enough, so it's something that you ought to at least consider as you look towards your next renewals. Now, a couple of assumptions that we used when we were building out this model. We had 34 people enrolled in the health insurance plan. We assumed that the same 34 people would continue to be enrolled. We're in Western Massachusetts, and some of the employees lived in Connecticut. And so in this case, Massachusetts individual rates are lower than Connecticut individual rates. And so what we did is we were able to skew the contributions higher for the Connecticut people to make sure that their costs would be lower as well. Basically, that $204,000 of total savings was going to be savings by each and every employee, plus a savings for the firm. Something that's interesting to note about an individual coverage HRA is that if people are eligible for Medicare, if they're over age 65, they do need to go and get a Medicare policy. So they're going to have parts A and B, and they were going to probably want to get a supplement or some sort of an advantage plan. We assumed in that $206,000 savings that everybody used up 100% of their total reimbursement. They might not. I mean, people might have, we modeled similar policies when we figured out the cost, but somebody might certainly would have had the option to buy a cheaper policy, and that would have increased the savings for the employer and for the employee as well. And like I said before, every employee ended up with a lower cost than they were currently paying, and the pricing ended up being affordable when you do the calculations with the Affordable Care Act. Pros and cons with an ICHRA. It depends on the client, but when it works really well. The math can be really, really compelling. And another nice thing about the ICHRA is that employees can buy any health plan they want. And so right now, this particular client, they had one health insurance company. They had 2 or 3 options available to the employees, and that's it. But now we were able to bring in a number of different health insurance companies. I think we were able to offer them 49, 50 plus different options that the employees could pick from, which really opened up a lot of potential options for folks. The potential downsides with the individual coverage HRA is the individual policies do renew on January 1st. So if the renewal is going to be mid-year, you're probably going to have to re-enroll for January 1st. But that's only an issue in the first year. After that, you'll be on a calendar year going forward. Depending on how you set the plan up, the administration for an ICHRA can be a little bit more challenging. It doesn't have to be, but it can be a little bit more challenging if you want to do the payroll deductions and things like that. If anybody new had enrolled in the plan, obviously that would have reduced the savings, but that's the same issue that you have with your group insurance plan, right? So if you've got 35 people enrolled and next year you have 40, it's going to cost you more. Same issue here. And so it's a potential con, but no different than group insurance. And I guess there's a potential downside of employees feeling like the choices are too broad or too confusing. I've gone from 3 choices to 50. But if you work with a good consulting firm like ours, we're going to be able to bring resources to bear for each and every one of your employees to make sure that they can navigate that process and pick the plans that are right for them. So just wrapping up the video here. If you want any additional information, you're welcome to give us a call. Our toll-free number is here, 866-724-0008. You can send me an email, pete@millbrookbenefits.com. And if you want, I actually wrote an ebook that covers a number of different cost control strategies. So if you send me an email, I can send you a copy of the ebook. It's called 8 Ways to Lower Your Health Plan Costs. Happy to answer any questions that you have. And also, if you call, ask us about our cost control audit. It's an interesting way to take a peek at a really deep dive of up to 12 different ways to reduce cost in your benefits package. Thanks for listening, and have a great day.